And I looked at my husband and I said, I think the tests in the Dominican Republic are different. I threw it away and I got another one.
Because like you said, this was unplanned number 3. Take us back to the moment you realized that this was happening.
This is rated G. Hold on, let me get my language together.
It is always an amazing experience to have everybody's favorite midwife on the couch this evening. Hey, Olivia.
Yes,
it is so good to see you and your glowing face.
It is nice to be seen. It is nice to be seen.
We are loving it. Listen, if it's one thing we know is that unplanned pregnancies are very common in the United States, right?
Yes.
And there are many different decisions that people make. Some people parent, some people decide to terminate, and some people will go on to give their child to adoption. But what we want to focus on today, and perhaps the reason why Olivia is glowing so much this evening, though she always looks stunning, she has an extra dash of glow this evening because she is with child. And we are so excited for number 3 that's coming.
Perfect timing. Unplanned number 3. Yes.
Unplanned number 3. So let's get into it. Because like you said, this was unplanned number 3. Take us back to the moment you realized that this was happening.
This is rated G. Hold on, let me get my language together. So I guess 9 months ago now, because I'm 36 weeks and some change. I was, it's the typical, you know what's funny? Any other time in my life, I get a little nausea or I feel funny. I'm like, oh, maybe I'm pregnant. Always. I don't know why. This time it didn't even dawn on me. This time my husband and I didn't even realize our birth control method had failed. Like we were completely, I don't know. We were just not, our daughter is 9, our son is almost 6, and we had said we were done. And so we couldn't even pinpoint when our birth control method had failed. I said, well, my period is late, which is common. I have a pretty long cycle, especially in the last couple of years. So I was like, let's just rule out pregnancy just to make sure. And then I'll go to the doctor and be like, okay, something's up because I haven't had my period in quite a while. Right? And so at this point, we're still living in the Dominican Republic, and I pee on the stick and I see 2 pink lines and my brain just will not register. And I was like, I don't know what this means. I was like, I think if I'm pregnant, it would be 2 pink lines in one window, not a pink line here and a pink line here. And I was like, and I looked at my husband and I said, I think the tests in the Dominican Republic are different. I threw it away and I got another one. The same thing happened. And I was like, this is broken. I don't know if this is positive or negative. I could not wrap my brain. My brain was not accepting.
English. Wait, I am bilingual.
So I looked at him in shock and I said, oh, I think I'm pregnant. And he said, what? I said, yeah. And I was laughing out of just shock. And then we sat in silence for at least a good hour. Like, we were a mess, to put it mildly.
How do you process something like this, right? Because you were done. You guys have made the decision that you were done having your family. You have 2 gorgeous kids, and you're blessed to have one of each also, which a lot of people envy. A lot of people want even numbers. I don't know why we're so fixated on that. And so you had the perfection, right? You had a reasonable sized family, each biological gender. And here comes this unplanned number 3. After you had reconciled your mind, or let me not put words in your mouth, were you very much content with the 2 kids? Were you done in your mind?
Yes, I was done. And we were discussing sterilization, but because we were in the Dominican Republic, we wanted to wait till we got back to the States so my husband could do it here. He was going to do it. So we were like, we were blessed. We had the 2 at some point a few years ago. We had kind of tried like non-committally. It didn't work, which was uncommon for us. Usually once we decided we wanted to have a baby, I would just be pregnant. And so after that, I was like, maybe it's not in the cards. We're getting old anyway. I'm 38 and he's 45.
Mm-hmm.
And I was like, cool. I think that was like we were not living the life of people thinking we were going to have it. I mean, when you say you have no, we were living in another country. Like I had left my career, my family. We were living like a different adventure with kids, and yeah, no, took the wind out of me completely.
So how do you adjust to that news? Because now you're pregnant, you've confirmed that the pregnancy is a viable pregnancy, and now your entire plan changed, right?
Honestly, if I'm being completely candid, that day I went to have an ultrasound because I said, I don't know how far along I am. I'm completely confused. I need to figure out what I want to do because this is the first time in my life where I am considering that there is a different option and that is not continuing the pregnancy.
Mm-hmm.
And it was the first time in my life that I considered that because I had never had an unplanned pregnancy. Both of my pregnancies were planned.
Mm-hmm.
And so once I confirmed that it was a viable pregnancy in my uterus, I saw a heartbeat. I was like, I was so dramatic on that table. I was crying. The doctor was laughing. I said, oh Lord, what am I going to do? How did this happen? He said, well, you know how it happened. I was like, hush. And I said, what am I going to do? And he said, well, you already have two kids. You know how to do this. I said, that's why I'm stressing out. I already
That's
know how
exactly
to
why,
do it.
because you know all that comes with pregnancy. So you're a midwife, you know more than most people what you're stepping into, right? And as you mentioned, you're now advanced maternal age, he's advanced paternal age. It's a whole different ball game. You
And,
guys are both what the word that we nobody likes. You're now both considered geriatric parents. Now, to start over, because your
and
youngest is how old?
my youngest will be 6 in January, and my oldest
So,
is 9. And I get diabetes and pregnancy, and I'm a midwife who ends up with C-sections. Like it's just not to wrap my head around all of that was quite challenging. So I had to really sit back. But
how
to
did you
answer your
wrap your head
question,
around it?
I think I got depressed for the first trimester. I'm not gonna lie. I kind of uh it was a rough first trimester. I had all the symptoms, right? I had a lot of morning sickness. I just wasn't feeling very well. And I really think I was kind of like in denial. I was like, well, God, you brought this baby to me. I'm throwing my hands up. And once I decided to continue with the pregnancy, because I really had to have a conversation. But the truth for me has always been I am pro choice completely. And I have a very hard time if I'm married and I have kids and I have the ability,
Mm-hmm.
then a happy, healthy marriage, right? So for me, unless there are incredibly extenuating circumstances, termination is not an option for me personally in myself.
Mm-hmm.
Once I acknowledged that, because I knew that anyway, then I think
Mm-hmm.
that's what was
Mm-hmm.
so sad because I was like, oh, I'm having another baby. You know what I mean? Like
Yeah.
once I realized that, it took me a while. I didn't really get out of bed very much. I mean, I did all the things I was supposed to do. I took the kids to school. I did all of those things, but I mean, I was even reluctant to take prenatal vitamins. I was almost like, I'm gonna walk in faith that this baby's meant to be here. This baby's gonna come. Women have babies every day and don't even know they're pregnant. I was a little bit disassociated from it, and I didn't
I
know
was
what.
going to ask you about that.
Mhm.
And so, at what point did you start to kind of accept the reality and start to bond with the pregnancy?
At what point? Yesterday? No.
I'll
uh,
bond at delivery, is what you said.
Uh, I am slow to change. So I would say after the first trimester, once I started feeling movement, which was pretty early, like at 15 weeks,
Oh, mhm.
oh, I said, all right. And then I was not diabetic early on, which I think the fear of diabetes again in pregnancy, was what I was really in denial about.
Can you share about that? Because diabetes is one of those things like when women hear it in pregnancy, it's kind of like, no, not that.
yeah. My
Why?
experience with gestational diabetes, my first daughter, I got diagnosed at 28 weeks in the third trimester, and I was able to control it with a pretty strict diet. I was dieting harder than I ever dieted in my life, but it triggered a lot of the diet culture body image issues for me. Um, uh, and so it was quite hard for me mentally and emotionally, to be honest. I had to check my blood sugar 4 times a day, fasting in the morning and 2 hours after every meal. And I exercised after every meal, a good 10, 15 minutes, whether it was Zumba or something. I got my heart rate up. And I was able to manage it that way up until the last week before I was induced. And they gave me, at the time, it was still recommended to take by mouth medications, like little pills. And then it went away after I had her. And then with my son, I was diabetic from the beginning. At about 10 weeks, they diagnosed me and I was on 2 forms of insulin. So I was injecting myself 4 times a day, checking my blood sugar 4 times a day. And
how was that shift for you, going from diet control to now insulin dependent?
it was terrible. It was terrible. I mean, because it was the entire pregnancy. So I had to work through a lot of fears of, is he going to be okay? You know, being in the medical field, you kind of start to be very much about the risks, the risks, the risks. You know, I have a higher risk of him having this. Maybe he'll be a stillbirth. I'm a Black woman. There were a lot of that. And so it really took a toll on me mentally and emotionally as well. And I had to be induced earlier because my body and pregnancy were acting more like I was a type 1 diabetic. The sugars were not easily controlled. He was tiny. He was starting to be growth restricted. So I was induced and ended up with a C-section again. So after that, I was like, you know, when I found out I was pregnant again.
You're like, I'm good. Two diabetic experiences, 2 C-sections, it's a wrap.
Yeah. And so I was pregnant again, it really I was like, I don't think I can go through that again. So that was really, plus I ended up with postpartum depression. I'm the poster child for all these kind of.
You know how they say you get whatever field you're in, somehow I'm not going to blame God. Somehow the universe.
The sense of humor.
Yes.
Yeah. So that's really what I was battling with when I found out I was pregnant. I was like, oh God, give me strength, because I don't think I could go through that again.
Do you ever have guilt of even considering not wanting a pregnancy? Did you ever have guilt of having those feelings?
No, because I think human emotions are natural. I think we all go through waves of things. And when my children are older, if they ever ask me, I'll be honest with them about it's the reality of who I am. I have doubt, I have fears. Nobody wants to be in pain. Nobody wants to be tortured. There are things that we experience and how we cope with those things. And it's how we rise to the occasion. So I'm very rarely ashamed of my feelings. Now, actions, that's a different story. But the things that you have to work through, you've got to work through. And that's just the reality of it.
Some patients sometimes I know are concerned that the kids can feel or sense their feelings. What are your thoughts about that?
Well, I thought that as well. And it was a challenge because for me, and I know it's not this way for everybody, but for me, I had a hard time connecting to my pregnancies, and they were wanted. I was like, it's a very abstract idea. I don't really know the beings growing in my body. And like I said, I'm slow to change. So like this time, this is my 3rd baby. So I feel like I'm doing it better this time. I felt like I did it better the 2nd time than I did the first. So I feel much more tenderness toward this pregnancy now. And I feel a little bit more connected. Like I'm excited because but I did with my daughter, with my first, I didn't. And maybe she did feel that. And that's something we worked through. And
should I bring her on the couch?
I know, I'm actually be like, my mama didn't want me. It's not that I didn't want her. I just didn't feel the connection, and I didn't know how to fake that I did. Right.
When did you start bonding with her? Have you bonded with her?
How's this? I loved her from the beginning. And I moved through the motions of everything I was supposed to go through, but I did not really I would say I did not really transition into loving motherhood and embracing the changes in my life until she was about 3 or 4. So the changes that came with motherhood, and again, I chose this. I was married, I had my career, were really shocking to me. So the loss of sleep, the loss of freedom, it was very, very hard for me. And then I got really bad postpartum depression that lasted for about 1.5 years. So she and I really went through it. She's my I love her. She's one of my favorite people in the world, this little girl, but she and I really went through it. And so I would say it took us a while. It took us a while to get our stride. So like I said, I loved her and I fed her and I hugged her and I slept her. I did all those things, but it does make me sad to now look back and say, I wish I could have like those people who like love their babies and adore them, and they're just
Yeah.
do
Yeah.
feel sadness that I was not able to feel that for my baby girl when she was a baby girl, right?
Mm-hmm.
So culturally, like I said, I hugged her and kissed her all the time and all those things, but I wasn't crazy about her. And it is hard to say that. It is hard to reconcile that. And so I've worked really hard. We've gone to therapy. Now, like I said, now I'm crazy about my children. I love being a mother. It is a part of who I am. But I did not transition well into it. And that is the truth. It took me a while, honey.
What would you say other women need to know who are having that challenge? Because I think for women who have shared that with me, it sounds like it's a very isolating experience because of the concern for judgment from others, or just feeling like you're the only one that feels this way, or some level of shame with expressing those feelings. What would you say to someone who has the same experience?
I would say that a lot of people make things up. A lot of people are struggling. I feel like we front a lot. And a lot of parenting is performative, whether it's performative for your family, for your friends. A lot of the things that we do, we don't realize we're doing because we think we're supposed to do, or this is how we're supposed to feel. So one of the things that really helped me heal was talk therapy, but especially not being ashamed of my feelings. Like I used to tell whoever would listen, and I know people judge me, and I didn't care because I was like,
I wasn't judging.
I was like, this is the truth. And I'm even sad about it. Like, this is the truth about what I'm feeling. Like people
Mm-hmm.
would say, oh, I know it's hard, but you've never felt love until you've had kids. I was like, I felt love before. Or like I remember feeling like, I don't know, my life was pretty great before too. Or you don't remember life before them. I was like, I remember life before them. And let me tell you, it was pretty good. And so
That. I'm not even kidding.
So it would be that. Don't be ashamed of how you're feeling. And the truth is, a lot of us walk through life not really knowing what's going on, and we just fake the funk. And that's cool. You can fake it till you make it, or you can be honest and give room for how you're actually feeling. And I think that if you give room for how you're actually feeling and voice that, then it's you. If you name it, you tame it. Then it doesn't have to be so bad, and you can give room for other things to arise. But if you're
Mm-hmm.
always denying the truth, then I mean, I don't know. I'm not a psychologist, but it would be that. It would be don't judge yourself. Be honest about what you're feeling, especially if there are feelings of wanting to harm yourself or your baby or anything like that. But if it's just doubt and questioning about like, did I just ruin my life? That's transition, baby. We don't always transition so well.
That's so true. And how did you create that bonding? Because you initially didn't really bond necessarily with her with your first child. And so for women who have challenges bond for various reasons, have challenges bonding with their child, what types of steps did you take to really, once you became conscious that that was a problem and ready to fix that problem? How did you address it? Did you go to therapy? Did you both go to therapy? Did you do activities alone?
I just never gave up. Like I never, I mean, she was my baby, she was my kid, and I was kind of like, well, maybe this is just the kind of mom I'm gonna be, one that's not, like again, you do the things you're supposed to do, you're responsible, but maybe
Mm-hmm.
I'm just never gonna be in love with them like that. And then through therapy, I've always kind of been in and out of therapy in acute moments of my life. I realized the truth was I've always been like that. When I love people, I'm slow to fall in love with them. I'm
Mm-hmm.
slow to like, so I think what I thought was that I was going to be a different version of myself. I was going to be the best
Mm-hmm.
version of myself. Soon as I had this baby and I got pregnant, I was going to eat the best. Like all the things I've struggled with in my life weren't going to exist anymore. Well, the truth was, oh no, they were still there, and I just had a kid. So the fact that I'm impatient was still there. The fact
That's so
that
good.
you know what I'm saying? Like, so I think that's what was disappointing for me. And so once I just acknowledged that I'm still me, uh, in a year or two, things started to kind of like get better. By year three, I was like, this is my little girl. I love her. She's got like, it's like I got to know her. Does that make
And
sense?
she's you.
Right. Like it was like it just took me a while to get to know her. Like I didn't fall in love with the stranger. And I think that's what I was thinking. That I was because she came from my body and I wanted her, that I was supposed to be in love with a stranger that I didn't know. And so
Mm.
once we built a relationship, once I got to know her, then I totally fell madly in love with her. And it was the same thing with my son. It wasn't as distressing because I was like, you know, Uh, he was a little different, so he brought out different things in me. He's gonna get his love no matter what. Like he's gonna, but it's the same thing. Like it just took, and so now I've been a mother for 9 years. Does that make sense? So now I have practice. Now my life has shifted around that. I'm crazy about my kids. They're like every day I fall more in love with them. But honey, that was hard fought. Like I had to get to know them. We had to create our relationship. And so with this one, I'm not afraid of that process. I don't judge that process. Again, her needs will be met. We are an affectionate family. We co-sleep. I mean, we do all of those things, but I'm not afraid of the bonding aspect. Like I know it'll happen, and it just, we are what we are.
Now you're able to give yourself more grace with that whole process. That's beautiful. And how do you so you went through a little bit of a health change before this pregnancy, right? And now you are pregnant again, and weight gain is coming, potentially diabetes is coming. How did
it came? I'm diabetic again.
it came? Okay. So how did you, after going through that major transition, how did you now reconcile the fact that your body's going to change again?
Like day by day, step by step. Okay, so the diabetes has been way easier to control this time, which is miraculous. I mean, miraculous. I take a little bit of insulin at night just so my sugars in the morning, and they're all normal. After my meals, they're all normal. I don't even have to check 4 times a day anymore because it's been so well controlled. My doctor and I, we check like a couple times a week just to make sure everything's okay. Her growth has been fine. So even with the diabetes this time, everything about this pregnancy has been challenging, yet surprisingly less challenging. I think once I acknowledged, okay, we're having another baby and all the transitions that come with that, I would say this baby has been surprisingly full of grace for me. Like she chose her mama, she knew what she was coming. And so I kind of feel like she's taken it easy on me. I really feel like I've gotten a lot of grace in this pregnancy.
Oh, that's beautiful. So, what about women who are concerned about being advanced maternal age and all the potential risks that come with that? And you knowing all the details of everything that can potentially happen, how do you go through the pregnancy, enjoy the pregnancy for as much as you can, being present and not have that fear overwhelm you?
So, because I was living in a third world country, something that gave me a lot, and I'm also not working clinically, so I think I kind of came out of the American healthcare system, which really does put a lot of fears into us in different ways. We're very much about risks this, risks that. So even when we think we're trying to just give you information, the truth is it creates a lot of even unconscious fears, right? Especially when you hear about statistics and Black women and our babies. So when I went to the Dominican Republic, my experience in the healthcare system wasn't that way. We lived there for 2 years. And there it's kind of like, bad things happen. It may be your fault, it may not be your fault, but here's the medication, try to do that. Like it wasn't so, you're sick, it's your fault. You're fat, it's your fault. You're dying, it's your fault. It's not so much, it's like, this is life and things happen. And we cry and we do, like that was, so it was very liberating. And then realizing that all over the world, people have babies all the time, whether they have resources or whether they don't, whether they're incredibly sick or not, whether they're drug addicted, whether they're sick like I am with diabetes. And most of the time, based off of our population numbers, we make it through. And so what that did for me is it helped me put something into perspective. It took a lot of the fear of this is my fault. It's fault because I'm Black. It's my fault because I'm fat. All of these things that I carried. And it has been a complete walk in faith, learning to have faith that things are going to be okay. I don't have control anyway. I almost killed myself in my first 2 pregnancies. And yes, my babies are healthy and they're alive today, and I'm really grateful. But it was a really hard won battle, right? Like when people used to say, well, I know it was hard, but the most important thing is that your baby's healthy. It used to feel very dismissive to me. It's like, yeah, but you don't know that I almost didn't make it through, right? Like there were some dark moments. In this pregnancy, that does sound like a lovely thing now. The fact that what is important is that this baby is going to be healthy. I am healthy, and everything else is really out of my hands, and I'm walking in faith. Like it really is like risks, risks, risks. But I mean, most of it is not within our control. There are some things. Yes, you can do like I had done in previous pregnancies, but the toll it took on my emotional state was just, it almost took me under.
Wow.
Mhm.
Yeah, yeah, no, you're so right. And a lot of people have echoed exactly what you said in terms of how the American healthcare system make moms feel like it's almost like the foundation is one of fear. And also I think even from the practitioner's perspective, it's heavily layered with fear and yeah, for various reasons. One of the things I thank you for sharing that you have experienced postpartum depression. So knowing that you've had a history of postpartum depression, how do you then prepare for this pregnancy?
So what I did with all three of them, actually, because I know that I was always prone to having really crazy PMS when I
Mm,
was young,
mhm.
I learned early on to be aware of my hormonal shifts and letting everybody around me know. I'll give you an example. Say I would be PMSing the week before my pregnancy. Somebody would say something at the dinner table, and I'd tell everybody, okay, everybody, I'm about to cry now. I don't know why. It's just my hormones. Keep going. Like the tears will come and they'll go, but I'm fine. So by the time
I so hear you. I know someone who has this tagline that where she's like, act normal. Like something crazy will be happening. She's like, just act normal, just act
it's fine.
normal.
And so when I had before
That's
I had
what
my
I
daughter,
envision.
yeah, so before
Everybody
I
act
had my
normal, about to
daughter,
cry, and just act normal.
it's gonna be fine. And so before I had my daughter, I told everybody that I was probably gonna end up with some type of postpartum mood disorder. And what I needed from them was to be able to talk, just talk and whatever comes up. If you see specific signs, like if you hear me say anything about wanting to hurt my baby or something's wrong with my baby, or if I'm not letting you hold her, because I'm not like that, like if I'm very, these are the signs of like postpartum psychosis. I went with everybody, my parents, my brother, like everybody who was going to be helping me raise this baby, my husband. I said, otherwise, just be there with me. Right. So about a year and a half in, I called my mom one day. I'm driving down the freeway. I'll never forget. And I called her and I just said, I have an overwhelming desire to crash my car into the center divider. Overwhelming. But I don't want to die. I don't even want to kill myself. I'm not unhappy. It's just an overwhelming desire. I said, so I need you to just stay on the phone with me and talk with me until it passes. And she said, okay, how's your day been going? And she literally just talked with me until it passed. And so with my son, everybody kind of knew as well.
Mm,
And with him, it was very different. It wasn't consistent. It would be in spurts. I would have acute episodes of like intense anxiety. Somebody was going to hurt him, something like a lot of anxiety. He was going to have SIDS. It would be acute, like maybe for 2 or 3 days, constant intrusive thoughts. And so with him, at one point, I did tell my husband, maybe 8 months in, I said, I may need to go on medication this time because I'm just starting to kind of lose my footing. I don't know if something is actually wrong or if my mind is now. And so I went to see a therapist a couple of times, and that was all I needed for that too. So for this one, I'll do the same. I'll keep an eye on it. Everybody keeps an eye on it. Everybody knows by now. And I have a lot of family support, a lot of friends support. And because I've been through it, I know how to verbalize through it. So if anybody is going through it, one of the most important things you can do is verbalize it. Have your safety net, whether that's one person or two people, if you have resources to go get therapy. And the great thing about perinatal mood disorders, especially postpartum depression, is that it will go away. It'll
mhm.
last for some people, but
Yeah,
it doesn't last forever.
yeah. How
So
long did it last for each pregnancy for you?
the first one was about almost 2 years. The second one,
Hmm.
again, because it wasn't consistent, I would say the whole first year I would have maybe once a month every cut like these acute episodes. So it didn't feel as heavy because it wasn't all the time. With my daughter, it was a constant. She
Yeah.
just blah. Um,
Mm.
to put it mildly. Obviously, it's more than that, but
Yeah, yeah. And for that reason, we're so happy that insurance companies are finally starting to understand the need for ongoing postpartum care for women. I don't even, we gotta go back. How did that 6 weeks happen? Anyway, 6 to 8 weeks happen. Um, but that being said, I mean, there's something to be said for the fact that you've had just the breadth of experience of motherhood, pregnancies, as a clinician, as everybody's favorite midwife. because you're able to really bridge both worlds, like the realistic aspect of going through and walking through these experiences, and then having the medical knowledge to understand and be aware of what you are experiencing. So that being said, we thank you for explaining about what it's like to have an unplanned pregnancy, be advanced maternal age, have an advanced paternal age partner, and then deal with diabetes, diet control, and insulin control, have C-sections, trial of labor. I mean, you have had perinatal mood disorders. I mean, you've had the gamut of it. Thank you for your transparency in explaining these very real experiences. So if I'm peeing on a stick, and this is a big if, this is a very big if. So if I'm peeing on a stick and me and my advanced maternal age self see a positive pregnancy, laugh a little too hard, Fred. Laughing a little too hard. So, what would be the first thing I should do with the stun of an unexpected pregnancy? Either I'm starting over and my child may be 12, 13, 16. Like, what do I do? Or I may not have had a child and had not planned to have a child, right? But I don't necessarily want to terminate. I'm now having to accept the reality of potentially parenting unexpectedly. My entire life has changed. What do I do?
Sit with it. Give yourself some time, really. I mean, even if it's just 72 hours, like we've got to learn to sit with the discomfort, the insecurity, and give yourself, your psyche, because it's almost like emotional trauma for some of us, right? It's like getting punched in the face. Wait a minute. And so we don't operate in our highest mind when we are in survival mode. So sit with it, because whether you terminate or not, unless you're really at the cusp somewhere, 3 days, 5 days a week is not going to change your decision making, again, unless you are at the decision making point. But even then, you have 24 to 48 hours. Like, sit with it, with it, talk it through, and just be honest with yourself. Like, if all the BS is gone and all the what I'm supposed to do, what I'm supposed to feel is gone, what do you really want to do? And then honor that in the best way that you can with whatever resources you've got, and be kind to yourself, because it ain't growing these babies and birthing these babies and raising these babies is not easy. And it's no joke, and it will change your life. So
it's so true. And I'm so happy to be a part of the village. I'm inserting myself into the village.
You've been there since the beginning, honey. Woo.
Oh man, I have real memories. And the fact that you literally verbatim said the same things that you said to me years ago with each experience, I'm like, man, those were true emotions. That's how you know she's telling the 100% truth. Very consistent, word by word. I remember exactly what she said, and that's exactly what she said today. So thank you for sharing. I mean, I feel like I've also gained even insight as a clinician as to what this process is like for women who have similar experiences. So if they want to learn more and follow you on this journey of motherhood number 3 times 3, okay, where can they find you?
Well, I am on Instagram at This American Midwife, but if you have any specific questions or really want to reach out, you can definitely send me a message through there, a personal, a DM. So you can slide into my DMs.
Slide into her DMs, okay? But not y'all who have other motives, because she's married. And I know she's looking fine with herself, but she's married. Okay. But that's awesome, because sometimes people don't necessarily want to have these conversations with people they know. And sometimes having a conversation with someone that they don't necessarily know, but have the same experience and they can relate to, is so valuable. And I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube, and Healthy Bump Club on Instagram. Thank you for our supporters. You guys are absolutely dope, whether you're doing to the apparel, doing through the music line, or doing directly, or just connecting us with people, going on your knees and saying some prayer, giving us some favor. We appreciate you all, however you decide to support us, and we'll see you guys when next episode. Bye.